Hey everyone, welcome to Psychology with my wife.
I'm the wife.
And I'm the psychology student.
Welcome to episode 17.
There we go, it's been a while.
A long while.
I think, January or something like that, maybe?
Yeah, and now it's July. August. Oh my gosh, it's
August now.
Holy smokes.
Yeah, and reason why is we had a little kid. His name is Jackson, and he's amazing.
Best little kiddo ever.
Yep. But he has been keeping us occupied for the last little bit. But we finally decided to do an episode. We needed one to push one out.
Ha 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 ha. But yeah, we're in Alberta right now at my parents' house, so we're just doing an audio episode here. So if you're used to watching the episodes, our next one will probably have video, but just since we're kind of doing this one in my parents' basement, so we're just doing audio for you guys today.
Yeah, hopefully I'll be using different editing software and stuff too, so hopefully it all works out. Yeah. Okay, today's episode is going to be on ADHD, or Attention Deficit Hyperactivity Disorder.
Awesome.
Yes.
This is a topic that I think people feel like they know a lot about, but maybe they don't. You know what I mean? Like, people talk about it a lot. I think people self-diagnose with this a lot. So it'll be great today for me and people listening to learn a little bit more about what it actually is.
Yeah, and exactly that. The first little bit here, I just want to quickly go over what the official diagnosis is in the diagnostic manual. And it's actually listed under a neurodevelopmental disorder. So other types of neurodevelopmental disorders include intellectual disabilities, communication disorders, that's like stuttering, and autism, learning disorders, and also motor disorders, which is something like Tourette's. They're all in that category. One thing about neurodevelopmental disorders is that they usually show symptoms in the developmental period, meaning quite young usually, and really up until they're an adult sometimes. This means that the current science suggests that you're born with the genes to have ADHD.
Okay, so it's something that can actually be recognized and officially diagnosed at quite a young age?
Yes, there is some. It is kind of a gray area, and just kind of acknowledging how children act,
Yeah.
and also do they have ADHD?
Because of course a lot of the symptoms of ADHD can also just be normal childhood behavior.
Exactly, yeah. Because symptoms of ADHD include inattention, disorganization, hyperactivity, impulsivity, which can look like overactivity, intruding others' space, inability to stay on task. So today, with that being said, today I just want to look at what the symptoms look like in children, what they look like in adults, the comorbidity of them with other disorders, with trauma, with addiction, some neuropsychological definitions regarding ADHD, treatment options available, parenting skills, and also some impact of social media and other mental disorders, just in terms of like validation and stimulation from social media.
Sounds good.
Yeah. So the DSM has a few different categories of symptoms that you need to have in order to be diagnosed with it. So the first one is a persistent pattern of inattention or hyperactivity, impulsivity. For inattention, it has to be at least 6 months to agree that is inconsistent with the developmental period and negatively impacts social academic endeavors.
I'm gonna be so annoying right now. Inattention is a word.
Yeah.
Wow, I feel like I've never heard that word before, and when you say it, it like hurts my ears a little. Like it sounds like one of those words that has like the wrong beginning in front of it. But
What did you picture? Not
I don't know.
attentive.
I can't think of a
Yeah.
different word that it would be, but I just feel like people just say like bad attention span or like something like that. So I'm like inattention. Okay, I'm learning new words here today, guys.
Yeah, so I'm gonna quickly go over to these because like probably most people don't even care about them too much.
Gotta cover our bases though.
Yes, there's 9 things that can be characterized as inattention. Often fails to give close attention to details or makes careless mistakes. Has difficulty sustaining attention in tasks or play activities. Does not seem to listen when spoken to directly. Does not follow instructions. Fails to complete schoolwork, chores, or duties. Difficulty organizing tasks and activities. Avoids, disliked, or is reluctant to engage in tasks that require sustained mental effort. Often loses things necessary for tasks or activities. Distracted by extraneous stimuli. Forgetful in daily activities.
So almost every single item you just listed there sounds like it could be a very typical behavior of, any child. So do they need to have a certain number of those 9 things for it to be considered an actual sign of inattention and possible ADHD?
They do. Actually, I didn't even write that down. I will edit it in the comment. There is a certain amount that they must have.
Okay, check the description.
Yeah.
We'll have it in there.
Yeah. Yeah, that's important, actually. I'm pretty sure because there's that and also has to persist for 6 months.
For 6 months. Okay.
Yeah.
That seems reasonable.
So it's most likely like 4 or 5.
Because often if a child is acting out or something, that behavior likely wouldn't last for, that specific behavior wouldn't last, or a combination of those behaviors wouldn't last for over 6 months.
Yeah, that's a pretty long time. Especially one key thing is when there's interventions. When interventions are done and their behavior stays the same, that might be an indicator that something's different.
Yeah. Absolutely.
And the other persistent pattern is the hyperactivity impulsivity. So that's like fidgeting or tapping, leave seats in situations when remaining seating is expected, runs about or climbs in situations where it's inappropriate, unable to engage in leisure activities quietly, often, in quotation here, on the go, talks excessively, blurts out an answer before the question has been completed, difficulty waiting their turn, interrupts or intrudes others, or it's asking or using other people's things without asking or receiving permission. One of the clients that I work with, he has ADHD as well as ASD, autism.
Autism, yeah.
Yeah. And he is bad. It's not a symptom. You can tell it's different from the other clients with autism that he is very intrusive and invades space.
In everyone's bubble.
Yeah. And takes things without asking, and like he knows he shouldn't take it, but he takes it.
It's really easy to see how so many people diagnose themselves with ADHD because from both of these 2 different lists, so many of those behaviors people have. And if they don't have the knowledge of, okay, well, I need to have this many of these behaviors for this prolonged period of time for it to potentially be ADHD, it's easy how people are like, oh, well, I'm always forgetful, or oh, that person is always intruding in my space, and these small pieces from these lists that just feel like, oh, well, they must have it or I must have it. So that's why it's really important people do not self-diagnose.
Yes.
If you are learning about topics like this and you actually are thinking, hey, I have quite a few of these things, well, then you should go and see your doctor and try to get an official diagnosis done if you think that it might be possible. Because then if you get an official diagnosis, you also can get supports for it too. So that would be the way to go.
Exactly. Yeah. And there is some stuff in the DSM to prevent that as well. Apparently, symptoms need to appear before the age of 12. And that's, again, because it's neurodevelopmental and it should appear by then. Otherwise, it might just be a problem.
A learned behavior or something.
Right.
Okay.
They must appear in 2 or more settings, which, again...
What's that mean?
Like you would have symptoms in, say, at home and also at school.
Okay.
Yeah.
So it's not just like, oh, they go to school and they act out like crazy, or they're crazy at home. It's...
Yeah.
Consistency is needed. Consistency of very inconsistent behavior.
Yes. Another one, too, is clear evidence that it affects quality of life, which, again, this is kind of like a doctor would just check mark it regardless. Like, that's not really... Obviously, they'll say, oh, because you came to me, it's clearly affecting you. And the last one is does not appear exclusively during schizophrenia or another disorder.
Yeah, because one of those other disorders might just have symptoms that overlap with it. But
oh, they definitely do. Like any high-end like schizophrenia, if they were having an episode, they would pretty much do all of those things. They would not have any attention and they would be hyperactive.
Yeah, so it's just being cognizant that you're not just diagnosing disorder or on top of disorder simply because there's overlap.
Exactly. Yeah. With all that, and it being genetic, there is some causes or reasons they suspect people have ADHD. One is a low birth weight, which in general seems to be like high risk for most things, right? I think that's what we learned.
Okay. It seems that it would be interesting that having a low birth rate would put you at a higher risk for ADHD if it's like a gene that you have, though.
What? Could you...
If it's a gene that you're born with, it just seems like what would your birth weight have to do with it then, if you're already born with it?
I don't know 100% about the birth weight, but because it's developmental, maybe there's a higher risk for things for not developing properly.
Oh, okay.
Yeah.
So essentially, you could have the gene, but if you had a higher birth weight and developed really quickly or something, then it might never show itself.
Maybe, yeah. Yeah. Smoking during pregnancy is another reason.
Yep.
And alcohol exposure in the utero. Which makes sense. I'd say smoking is probably worse than alcohol. Both are very bad, but smoking is horrible.
Yeah, I would just say they're both very bad. Don't do either.
It also has a high comorbidity with oppositional defiant disorder, which is basically resisting conforming to others' demands, negativity, hostility, defiance. Some articles suggest that it's as high as 60% comorbidity rate. And yeah, if someone has ODD, it's...
oppositional defiance disorder.
Yeah. You'll say something and they'll purposely they almost seem like agitated that you told them to do something and do the opposite, even though it doesn't make sense. Yeah. It's annoying. They are also significantly more likely to develop a conduct disorder, which is aggression towards others, serious violations of rules in childhood. And this actually equates and is the same thing as antisocial personality disorder in adults. So the only difference between those two is that the conduct disorder is a child and antisocial personality is an adult.
Oh, okay. I was just talking about this with Julian's brother's girlfriend, Ashley. And she was saying that conduct disorder you have as a child, but there can be an intervention and it is a behavior that can be stopped. Whereas once you have antisocial disorder, then it's like more so permanent.
I
Or that like conduct disorder could turn into antisocial disorder, but that if there's an intervention early enough, then it could be like prevented. Does that sound right?
yeah, it's not like it's literally the same disorder is what it is, but one's in childhood, and I think that's just because a cultural thing.
Oh, okay.
Yeah,
Maybe
but
I just misunderstood what she said then.
I think maybe what she could be getting at is that it's just been ingrained for so long that it becomes because antisocial personality disorders, that's a lot of like serial killers have those personalities, right? And it's a personality, meaning that it's not, it's a learn, for the most part, a learned behavior.
But it is something that someone could have and they wouldn't even know it. People might just think, oh, they're
Yeah,
a
yeah,
little maybe isolated or quiet or
yeah,
don't seem the most empathetic, but they wouldn't instantly be like, holy smokes, this person could be on American Psycho.
yeah. No, exactly. Not everyone's a serial killer that has it.
No, definitely not.
Um, and it also, because of these, basically because they have a high comorbidity with these disorders, it also increases their chances of substance use disorders. They're also correlated. Yeah, so we kind of mentioned before, you often hear kids being diagnosed at a young age, and how one of the arguments is that against it is that they just may be kids. What do you, like? Do you think that's the case most of the time, or
I definitely think that more recently we've been seeing increased diagnoses towards ADHD that probably aren't correct.
yes? Yeah,
Like, I think that it's become. I don't know quite how to say this right, but that it almost has become an excuse that, like, oh, if this child's misbehaving or what people deem to be misbehavior or disruptive behavior, it's easy to just put that label onto them and say, oh, well, they're behaving this way because they have ADHD,
yeah,
versus putting in, a lot of effort to try and have more interventions to change or alter
yeah,
their behavior.
yeah. And some kids, obviously not like a completely experienced parent, but watching other kids.
We've had a child for 5 weeks. I'm not a completely experienced parent, but
Watching that and at work, some kids are harder to deal with. I don't know if that's the right word, but like help guide. They just aren't, they don't want to listen, or they just feel like they don't understand consequences, stuff like that.
Well, you think a lot about the very basic argument of nature versus nurture, right? So it might not be in some of these kids' nature to behave with these characteristics, but because of the way they're being nurtured, perhaps at home, perhaps with people they're interacting with at school in different environments, these behaviors are coming out or are being learned. But it doesn't necessarily mean that they were born with this gene, right?
Yeah, yeah. And that's why I think I wouldn't call it bad parenting, but I think maybe sometimes parents won't realize the difference in their kids, I guess, and that they need to take a different approach with different kids. And if it's not dealt with properly in some cases, and although it may be difficult to do that, it can look like ADHD.
Maybe it's possible that people might sometimes think that, oh, they'll just grow out of this behavior, which they might, but I think often some form of intervention needs to take place to help guide them to learn new behaviors and grow out of it versus just making the assumption that, oh, once they're older, kids will be kids. They'll grow out of it eventually.
Yeah, yeah. But all this being said, kind of makes me think that there is some cases of ADHD, such as Gabor Mate suggests, that it's caused by unregulated emotions growing up.
Mm-hmm.
I definitely agree with that. And basically, it's essentially the parents weren't able to help the kid with their like mental difficulties or emotional difficulties.
So is he saying that it's not a gene then?
I think that's his main thing, is that it's a learned behavior and a way to
Okay.
cope.
Mm-hmm.
But I don't think that's completely true.
And I don't even think those two arguments actually have to be polarized, right? Like it could still be a gene, but having this learned behavior brings it out
Mm-hmm.
of you,
Yeah.
right? Whereas you could still have these same environmental factors, but if you didn't have the gene, maybe you wouldn't exhibit the behavior. But if you have the gene and the contribution
Mm-hmm.
of these environmental factors, maybe together, that's what makes these children exhibit these behaviors or makes ADHD symptoms come to the surface.
Yeah, exactly. And that's, I think, a way that more practitioners should go, is the like cognitive behavioral direction. Is that, yes, people have a genetic predisposition to act a certain way, but they're acting a certain way in an attempt to regulate their behaviors, I guess. Because a kid, if they weren't taught or helped how to regulate their emotions, they will look fidgety and they'll distract themselves and maybe, I don't know, eventually use drugs and stuff to try to regulate themselves, right?
Yeah, I get what you're
Yeah.
saying.
And also, I think it's an epigenetic thing as well, meaning that the environment will unlock those symptoms of ADHD.
Yeah.
Yeah, and you said it's not necessarily a cop out, but parents use that as an excuse.
Parents
Yeah.
or coaches or teachers,
Yeah.
doctors.
I think even like, I don't know, teens or young adults do it a lot on TikTok. I've seen a few videos and it actually annoys me. It's almost like a cop out because they can't focus or get things done and stuff. But
But
again,
they're self-diagnosing.
yeah,
Yeah.
exactly. But like, honestly, it could just be they're overexerted at work. They're stressed out.
Overstimulated.
Mm-hmm.
Mm-hmm.
Yeah. They spend all day looking at TikTok videos and then wonder why they can't focus on something more than 8 seconds. Or they'll just cite like a single article and be like, "Oh, I have this symptom, and the science shows that it has to be ADHD."
But again, go get the evaluation and get an official diagnosis.
Yeah. There has been some research, although it's minimal, that individuals with ADHD are at an increased risk of problematic social media use, in, I would say, an attempt to self-soothe. Okay, we're moving along quite well.
Awesome. First episode back. We're flying through.
Mm-hmm. And that's okay if it's a little shorter.
We'll ease back into this.
Yes. So next, I want to go over the treatment options for ADHD.
Okay.
Just as a basis for this part of the conversation, it's well known that ADHD is related to a deficiency of dopamine in the brain. Because of this, individuals with ADHD are wired to seek more exciting experiences, etc., than neurotypical individuals. And neurotypical means someone who does not have ADHD. And that could be a reason why they're like everywhere. They're constantly searching for that like dopamine hit.
Yeah, that definitely makes sense.
That being said, there's deficits in their dopamine, and it can occur at any point along their dopaminergic pathway.
What's that word? Make you say it again.
Dope. I might have butchered that.
I don't know what the word is, so I'm going to just say that you nailed it. Anyway, sorry.
Yeah, dopaminergic. Some new studies have shown that individuals with ADHD have a higher DTT, dopamine transporter density, meaning that dopamine is more quickly removed from the cells. So I don't want to go into too much detail about this, but basically there's dopamine pathways in your brain. And one of the ways that our brain uses dopamine is that it uses transporter cells or transporters to remove the dopamine from our cells. And then it goes into a synapse and goes on potentially to the next cell. That's how the pathway works.
Okay, complicated, but also straightforward, sort of.
Yeah. So people with ADHD have more of these transporters, so they can take dopamine out of the cells quicker, meaning that it doesn't last.
Gets depleted faster.
Yes, exactly. So they still have the same pathway. It's just like, I don't know, I kind of like literally picture it as like they're on hyperactive mode where everything's moving faster.
Yeah, I think you can pretty easily create the picture of, when people always say like, oh, I have a really fast metabolism. So they say that like they get hungrier faster, or they stay skinnier easier because they're burning so much energy. So that's kind of what I'm picturing in my mind when you say that it's just working quicker than, or moving it, transporting it faster than some other people's.
Yeah, exactly. Meaning your reward pathway means if you do something, you get a reward, a shot of dopamine, right? So it wouldn't be maintained enough for you to be concentrated and focused on that one task for long enough. You get a hit, it's gone. Move on to the next thing, kind of thing, right? And it makes sense that way when you see their behavior.
That's why there's lots of tasks started but not completed, perhaps.
Yeah. Other researchers suggest that the cause of ADHD could be more related to a reduced amount of gray matter, which is basically your dendrites and cell bodies in the brain. And essentially, that would just mean it kind of reduces the connectivity in the brain and the function of the reward pathways. So they're not as dense, in my opinion. Yeah. That's what it would be. So this is my analogy that I was thinking of. We were playing the Mario 3D World.
Mario Kart 3D. Oh, yeah.
Yeah, the one with the cats.
Super Mario 3D World.
Yeah, where you can change into cats and leaf persons. I thought of the reward pathway as like a bridge, one of those bridges in the game that you have to go over, but the tiles fall.
Oh, yeah.
And basically the other side of the bridge is the reward that you want to get from a task. So both ADHD individuals and neurotypicals are both going to try getting over to the side in this situation. But I would consider the dopamine is like the building blocks of this bridge that are going to fall away. So for the neurotypical, the tiles are going to stay up longer when you step on them. And there's also going to be more of them. So you can take your time going across the bridge.
Yeah.
Whereas the ADHD individual is going to kind of have to go quickly, and there's not much time to think about what you're doing, right? Then you land on the next one and you have a choice to go left or right. You don't have time to make a decision, so you just go away. And I think that's kind of makes sense a little to me.
Yeah, I like that.
Yeah.
If anyone has played that game, hopefully you're able to follow along with that.
Yeah, so the most common treatment for ADHD is to prescribe stimulants such as amphetamines, which is Adderall, Ritalin, to increase the level of dopamine in an individual's brain, theoretically making them function better, normal, I guess, maybe is what they use for terminology. That being said, it's pretty common with people with ADHD to self-medicate using other ways that you can get dopamine. So obviously food, a big one, social media, sex, other drugs. You could see how, because methamphetamine is pretty similar to amphetamine, and a lot of people would feel better using those drugs.
So is it common for people who have ADHD to also experience addiction in some way?
Yeah. It's, to be honest, most disorders in the DSM, there's a high comorbidity of some other type of thing. Addiction seems to be a common one.
when it can be addiction of many things, like you listed all of those other things people might go to get those stimulants.
Mm-hmm.
So it might not just be drugs necessarily, but it could be food, it could be relationships, different things like that.
Mm-hmm. Then you throw in Purdue Pharmaceuticals, and you have again, theoretically, I don't think this isn't the case with ADHD medication, but you could think that you're being prescribed something, maybe it's too much or too little, and it's affecting you in bizarre ways, and you don't think twice about it because it's legally prescribed to you.
And you're just trusting that your doctor knows
Mm-hmm.
what they're prescribing. But
Yes.
reality is that if anyone caught Julian's mention of Purdue Pharmaceuticals, if you've watched the new show on Netflix called Painkiller, very good, highly recommend, all about OxyContin and essentially about how doctors were being, in some senses, manipulated, or in some senses, also just like down to benefit from overprescribing OxyContin to people,
Mm-hmm.
and the
That
epidemic that caused.
that actually made me think. I kind of want to look into what differences there are for a public healthcare system versus a private healthcare system in terms of insurance payments to doctors, because although it still is somewhat of an epidemic in Canada, I think it's far less than what is happening in the States.
Yeah, I wonder, because in that show, the doctors, it seemed, made money based on the prescriptions they wrote.
Per milligram, actually.
Yeah,
Yeah.
whereas I don't think that happens in Canada.
No. But I would like to actually know if maybe it's prescriptions in Canada. Maybe that's how it works. I don't know.
We should look into that more. If
That
anyone out here is like in the
Mm-hmm.
healthcare system and knows something about how that works
Mm-hmm.
in comparison to the States, definitely drop us a comment somewhere and let us know.
Definitely, because I think just being paid on prescriptions, yes, it's still
Encourages overprescribing.
somewhat, but at least then it doesn't encourage over
Dosing.
Yeah, which I think is far worse than overprescribing, at least. Who knows? So I will look into that, and we'll find out in a future episode. With all that being said, people actually abuse Adderall and Ritalin when they don't have ADHD because it provides an euphoric effect.
Yeah, we've definitely seen that in the university setting.
Mm-hmm. Yeah, it's quite common there. And, like people that don't have access to hard drugs, illegal black market drugs, they will get Ritalin and chop it up and snort it.
Oh.
Yeah, you've never heard of that?
No, I'm not that deep in the Ritalin game.
Yeah, I've seen that happen. And people diagnosed with ADHD will not take their meds and sell it to make money.
Yeah, I know of that happening, or people getting prescriptions that they don't actually need, so then they can sell.
Right. What can you do about it, though? Also, another thing to take note of, again, I'm not a professional yet, but if someone is prescribed ADHD medication and you notice that their symptoms start to get worse, maybe that's a sign, like we just talked about, because when you don't have ADHD, it actually makes you more hyperactive. Maybe that's a sign that they don't actually have ADHD, and it's another issue.
Mm-hmm. Yeah, that makes sense.
Again, it could be too low of a dose, too high of a dose, because I could see that happening as well. But yeah, again, just get a trusted professional's opinion on the proper treatment. And I'm not bashing a regular medical doctor, but get a specialist when you're taking drugs like this. It is a wait list, but that should eventually be down your avenue of treatment.
If you're looking at getting onto medication like this, that's something long term for your health that you're going to be on.
Yeah.
So it definitely is worth the extra time and energy and effort that it would take to make sure that you're getting the right dose and the right medication. Because you don't want to be taking something for years that was actually maybe exacerbating a problem for you.
Yeah. So I actually found a study in terms of taking amphetamines in the BMJ journal, and they looked at the correlation between ADHD, children, and methylphenidate, which is, I think that one's Ritalin. Don't quote me on it, but the generic name for it. They found that children who took this medication, their classroom performance improved, and it comes with non-serious side effects such as sleeping problems and decreased appetite. And there was no serious side effects that parents should be worried about.
That's so interesting that they would consider sleeping problems and a decreased appetite a non-serious problem, because to me, like, those are pretty serious. Like, if a child is not able to get a restful sleep anymore, that's going to really negatively impact them.
Mm-hmm.
And if they're not hungry and then not eating food, like, those to me, I know they're not maybe as immediately detrimental or serious as some side effects can be, but long term, to me, those are pretty serious side effects to just be writing off like, oh, parents shouldn't be worried.
Mm-hmm. No, I agree. And to be honest, I don't know the research specifically on ADHD and gut health, but they're finding the importance of gut health in your mental health. So again, that would just make it worse almost. And also sleep for me is a big one. If I can't get somewhat of a proper sleep, I start seeing symptoms. So also there is behavioral therapy treatments that individuals with ADHD can utilize to improve their quality of life. The focus of these therapies would be learning new skills and coping mechanisms to deal with their symptoms. And used in conjunction with medication is the most helpful way to get a higher quality of life, because the medication can sometimes take the edge off of things and at least give you a little more focus and stuff that is required to get the most out of therapy. That's what I would recommend. With that, again, the evidence suggests that short-term use and somewhat long-term use will not cause adverse effects with this medication. But I know from my experience in the AA rooms, they commonly say that it takes about 18 months for your brain to chemically go back to normal. Anecdotally, that makes sense to me. I don't know scientifically, but you're putting a chemical in your brain and it's going to change the way your brain is. It's going to form pathways using the addition of the neurotransmitters. And when you take that out, because it has similar effects as like cocaine or methamphetamine, you're going to have withdrawals of some sort, I would imagine.
I would think so.
And with the withdrawals, it's kind of indication that your body needs to go back to normal. You're normal, I guess. I know they say there's no adverse effects and stuff, but maybe they're not permanent. But there is somewhat long-term, short, medium-term effects. A final little thing I want to get into here is just misdiagnosis. A recent systemic review by Kazda and her colleagues suggested that ADHD is over misdiagnosed in children and adolescents.
Yep.
Because I know for me growing up, a lot of the time in the younger grades, there was a lack of stimulation. I caught on to things in the lower grades quite easily. But then once I got it, I couldn't, it's just boring, right? And I could see a lot of kids appear to have ADHD because, well, maybe they're just smart, honestly. On that same note, less is known about the symptoms of ADHD in females. They suspect that they show up differently than males. So that's another issue that can cause misdiagnosis or overdiagnosis. I briefly touched on this, is if your medication is not helping, your ADHD in quotation marks may be a different type of disorder. And you know what? Trauma can cause the same symptoms. PTSD can cause the same symptoms as ADHD. Mania can cause the same symptoms. It's worth discussing with your healthcare professional about these things. And if it's the wrong medication, it can make symptoms worse.
Which is why it's good to go to an expert, because hopefully they will be having those slightly longer conversations with you before giving you a prescription to try and understand your health journey as a whole and make sure that they're not prescribing wrong. Whereas, at least I've heard that when you are getting prescriptions from just a normal doctor or something, it's usually just like a quicker conversation and they'll be like, okay, well, let's try this. Whereas if you've gone through the time and you're seeing that expert, there should be, and if there isn't, then advocate for yourself to make sure that you're having that long, detailed conversation with them before just accepting an immediate diagnosis and prescription.
Yes, I agree. And, one thing that I don't think is weird to say about kids is a lot of kids can have anxiety. And maybe it'll show up different than an adult, but like you can see kids that fidget or they're really restless and stuff like that. Maybe they just have anxiety and they're just like high strung.
Well, they have anxiety and they're overstimulated now, right?
Yeah.
Like there's just so much going on with whether it's being on social media, TV, but it just feels like not just kids, but everyone, us included, are just constantly being stimulated by things, which I think can also show up as looking or appearing like anxiety.
Yeah. And to be honest, if you spend like I know I've done this before, honestly, sad to admit it, like sat on my phone for like 4 hours straight and just
scrolling.
Yeah. And I don't think people should underestimate the effect that what you do during your day has an effect on your attention span. Like we're kind of trained, I'm not saying like conspiracy wise to have a certain attention span, but when you watch movies that are 20 minutes long or TV shows that are 20 minutes long or movies that are 2 hours long or TikToks that are like a minute long, that trains our attention span. So.
Well, it's funny. We're getting a little off topic here, but oh well. How if someone releases a movie that's like 3 hours long, we'll be like, oh my goodness, are you kidding me? You want me to sit here for 3 hours and watch this movie? But we'll gladly sit and watch 3 like 45-minute long episodes or 6 half-an-hour long episodes, like no problem.
Yeah, I know. I kind of like the longer movies, and it's an excuse. I don't feel so bad about watching this. It's like I only watched one movie.
I didn't binge a show all day.
That's pretty much it. Final thing again, emphasize, do not self-diagnose yourself based on or others, yes, what you see on social media or what you believe in your own research
don't take anything we said today as medical advice.
Exactly. Go talk to a psychiatrist or psychometrist to receive a professional opinion and be safe out there.
We haven't ended an episode in a while.
I know. Yes.
Bye. Peace.
Yeah.
Later.
See ya.
Oh, wait. I guess we need to ask people to subscribe.
Yeah. But first, if you have a topic that you'd like us to talk about, send us a message in our DMs on social media and email, or we can be found on Patreon. And also leave us a review, and we will see you next time.
Bye, guys.
Bye.